The following step-by-step procedures and clinical case were photographed and provided courtesy of Dr. Alan Schneider from his private practice in Springfield, Virginia. This acrylic mandibular model is used to demonstrate the restoration of two externally hexed implants that have been placed in an elevated location at the same level as the surrounding gingiva. The locator abutment driver is the gold-colored portion of the locator core tool, which also contains a male removal tool and a male seating tool. The abutment driver is used by hand to insert the abutment into the implant and tighten it firmly. Higher torque tightening of the locator abutment can be achieved by using a 20 Newton-centimeter torque wrench and a .050 or 1.25 millimeter hex tool insert. The backside of the locator abutment driver has an internal hex that is designed for use of a torque wrench. A maximum of 20 Newton-centimeters of insertion force will prevent the abutments from loosening. The locator abutments maintain a very low profile, even on implants placed as shallow as those used in this demonstration model. Snap a locator parallel post onto each abutment to check that the implants are parallel. If the implants are not parallel, Zest Anchors provides an alignment pin and angle measurement guide that can be used to easily determine the degree of divergence of an implant fixture. The alignment pin has 4 different thread patterns that will match those types of implants on the market. Insert an alignment pin into each divergent implant. The angle measurement guide is held level with the path of prosthesis insertion to determine whether the degree of divergence for each implant will require the use of a locator white or green replacement male. A locator impression coping and abutment analog are used for the indirect processing of the denture cap male by the dental laboratory. Place a locator impression coping on each locator implant abutment. Inject a light body vinyl impression material around each impression coping. Take a complete impression using a firm body impression material. The locator impression coping is designed with minimum retention to be picked up with a completed impression. The locator abutment analog is designed with a very precise fit into the locator impression coping, allowing for an accurate transfer to the working model. Snap a locator abutment analog into each impression coping, making sure they are fully seated. The master cast is poured, incorporating the locator abutment analogs. The abutment analog in the master cast replicates the exact position of the locator abutment in the acrylic model. Place a white blockout spacer over the head of each abutment analog. The spacer is used to block out the immediate area surrounding the locator implant abutment. Snap a locator black processing cap male onto each analog, leaving the white blockout spacer beneath it. Process the males into the denture base with light-cured or self-curing acrylic resin. Discard the white spacers. Damage to the final male can be avoided by polishing the denture base before changing the black processing males to the final nylon retention liners. Use the male removal tool or an explorer to remove the black processing male from the metal denture cap. The hook on the end of the curved tool is used to catch the side of the black plastic material and pull it out of the metal housing. The nylon locator replacement male replaces the black processing male for the final seating of the overdenture. The male seating tool is used to place the nylon replacement male into the empty metal denture cap. The replacement male should seat securely into place, level with the rim of the cap. Check the fit of the attachment retained overdenture on the master cast before delivering it to the dental office. The indirect processing of the locator male into the denture by the dental laboratory produces the same accurate result as a direct chairside pickup. The self-aligning ability of the locator implant attachment aids the patient in orienting their prosthesis, which is vital with the existence of a severely resorbed mandibular ridge. This patient that was referred to Dr. Schneider has 2 externally hexed mandibular implants. The gingival level surrounding the implants was very shallow, as can be seen by the hex of the implant extending above the crest of the tissue on the patient's right side. With limited space available, Use of the shortest attachment possible was indicated. Locator abutments having the lowest tissue cup height were placed using the abutment driver. A torque wrench was used for final tightening to 20 Newton centimeters. When placing multiple attachments, snap a parallel post into each seated locator abutment to check the parallelism between implants. For this patient, the locator male was placed into the overdenture using a chairside procedure. First, a white blockout spacer was placed over the head of each locator abutment. Then, a locator cap with black processing nail is snapped onto each locator implant abutment, leaving the white spacer beneath it. Recesses were prepared into the denture base to accommodate the locator males. Light-cured acrylic resin was injected around the metal cap of each processing cap male. The resin can also be injected through an access hole in the denture. The denture was inserted into position in the oral cavity, maintaining the denture in a passive condition without compression of the soft tissue while curing with the light. An additional brief curing time on the lingual side of the denture will assure fixation of the locator male into the denture base. The white blockout spacers remained in place when the denture was removed. The white spacers are easily removed with an Explorer instrument. Use a burr to remove excess acrylic and polish the denture base before changing to the final nylon male. The locator core tool contains 3 tools in one. Start with the fully assembled tool for the procedure of replacing the black processing males with the final nylon male. The curved male removal tool portion of the locator core tool has a hook on the end of it. Wedge the hook down into the bottom corner of the black plastic male. The hooked end of the male removal tool will catch the side of the black plastic material and pull it straight up and out of the metal housing. Remove the curved section of the locator core tool to access the male seating tool portion. Place a nylon locator replacement male onto the end of the male seating tool. Use the tool to firmly push the final locator male nylon liner into the metal denture cap. The overdenture was then ready for delivery to the patient and final adjustments. A beautiful aesthetic result was achieved for this patient using the low-profile locator attachments to retain the overdenture. With the incredible retention of the locator overdentures, don't be surprised if your patients take up a new hobby like this. Additional information and technical assistance is available from Zest Anchors Incorporated by calling toll-free 1-800-262-2310.